Nearly everyone will experience injuries at some point in their life. Most minor wounds can be treated, but some can get worse if not properly attended to, often leading to a lifelong journey coupled with pain and stigma from our society. On our Health Heroes segment, BBC's Mercy Kandia visits Emmanuel Mose, a wound care nurse in Nairobi whose dedication has brought dignity and smiles to his patients.
My name is Innocent Nyarik Mose. I am a wound care specialist in the hospital. I work in the Nairobi Hospital. There is a diary in the hospital or in the wound care room whereby we book our patients. So when I get in at 7, I'm at work, I've started. I clock in. And then I go to the dressing room where I take my diary and see all of the bookings. Then after seeing the bookings, I'm able to come up with a care plan and to schedule the time when I'm going to see my patients. I've been working as a wound care nurse for 5 years now. I trained as a Kenya registered nursing, and I worked in the accident and emergency setting for 2 years. But since I had a great passion to do wound care, as I wanted to improve the quality of life for patients who have wounds. Because wounds, they really have a large burden on a patient, more especially the psychological part, whereby the patient tend to isolate themselves. And at the same time, patients use a lot of money to go and dress their wounds. Then I go back to the ward to check, to do the dressings of those patients who are due. But now, as I've worked with many plastic surgeons and physicians, even general surgeons, I've managed to gain a lot of experience in wound care, and the hospital has also managed to support me to get short courses and trainings.
My role as the surgeon and the role of the nurse are very intertwined, in the sense that in most scenarios, the nurse is the person who is the first point of care when it comes to a wound.
There's a lot of stigma. We find that everyone is shying away from taking care of wounds. That's why I came out to bring that change for humanity, because we always want dignity. We want to be treated with a lot of dignity. And due to this wound care, many people are even able to continue with their normal life. A wound cannot prevent you from even going to have your social parties, because when the wound is dressed nicely and the infection is controlled, you are able to operate, even go to work. Many people have a myth that if a wound is left open, you find that it will heal, and it is not true, because when you leave a wound open, it becomes dry and the cells dies. So when the wound is covered, there is what we call moist wound healing, whereby now the wound is able to heal in a systematic manner. And in wound care, you see this wound has been treated and it's smelling, and it has been managed for 10 years, you know, and the patient is in pain. The pain is 10/10, you know, and the pressure may be crushing. As I've done my wound care, I met an old guy who told me one thing that I remember. He told me that if you really love your job, and you do, then God must help you. And I took that one positively, and it has really helped me to move me to the next level, because in this world we need to make other people feel better, and that is a great contribution in humanity. These are the do's of if you have a wound. Number one, make sure that you change your clay bandage daily. If the wound is oozing or removing a lot of water, make sure that you are clean. You change your clothing every day. Make sure that even your beddings are clean, and make sure that you eat foods rich in vitamin C, especially the citrus fruits, oranges, lemons, mangoes, etc. And then also you have to be calm. You have to remember that, because healing starts from the mind. Before you do all this, please make sure you consult a doctor urgently. Okay, these are the don'ts when you have a wound. Number one, do not keep it open because it can get infection. Number two, do not operate in a dirty environment because in a dirty environment is where you get bacteria getting into the wound. Also, make sure that you don't fast, more especially because your body needs nutrients to build your wound. Number four, make sure that you don't stay at home without going to see the doctor. And also make sure that you interact, not isolate yourself, because healing starts from your mind. I'm here to meet one of my clients to see how she's faring on.
The problem with my leg started 2 years ago, and it's up to today, but I'm to the end. For 1 year I went everywhere, left and right, many wrong medication and errors. For 1 year I was really in pain, almost every other day. I had to take antibiotics, intravene most of the time, and that one changed all my life. I can't work as before. But thanks to God, the last 9 months, I'm carrying on with Moses, and we are almost over. The problem is to the end. I trust him so much that he knows his job very well.
And the swelling of the leg is okay?
Yes.
In my work, I've been happy because you find patients who have given up, they are able to have a smile and they are able to be happy, and even their family members.
I feel good, da-ra-ra-ra-ra-ra. I feel good, da-ra-ra-ra-ra-ra. So good, so good. Tan-tan.